Hi, Patricia. You okay?
Yes, thank you. Yeah, I am.
Oh, good. Oh, thank you for joining. Where are you from, Patricia?
I'm from Northern Ireland. I haven't used online for a while. So I'm just trying to get my head around it.
It's no problem at all. It's no problem. Honestly, I'm not the greatest at the tech myself either. With Google Meet, all of the controls are just down the bottom.
Yeah, I
So
see
I
that
think
now.
and probably one of the only ones you'd need as well would be the little speech bubble, which is to the right at the bottom if you want to put something in the chat.
Oh, yes. Uh-huh.
Oh,
There.
marvelous.
Yeah, got that. Yeah.
Fabulous. I remember coming to Belfast to deliver my stress and anxiety ear acupuncture course. It was quite a good few years ago now. I think potentially 2018, I'm going to say. Might have been slightly earlier. We had a fab time. It was great.
Yeah.
It's the first time I'd been to Belfast. What an amazing city that is.
Oh, it's lovely, isn't it? Yeah.
It's incredible. It's so interesting, isn't it?
Yeah. Where are you from yourself?
It's really cool. So I live in South Birmingham.
All right.
Yeah. So I live in Bourneville near Cadbury's.
All right. Yes.
Chocolate factory. Yeah.
Yeah.
So a little bit of across the pond from you, but I mean that's the beauty of online, isn't it?
Yeah.
It's a good thing. What do you practice? Which therapies do you practice?
Well, I do aromatherapy and reflexology.
Good.
I do a lot because I've been doing it a long time. You know, I always keep on doing more and more training, like Reiki and sports massage, and what air acupuncture is one of the things that I did train in, and that was for drugs and addiction. So I'm just interested to see, you know, because that's only the focus that we have, and I know there's so much more that you can do with it, you know.
Oh, yeah. So you would have learned the NADA protocol, the 5-point NADA protocol.
Yeah.
Yeah. So who did you train with, NADA?
Yeah.
Fab. Wonderful. Did you train with Anne by any chance? She tends to do Northern Ireland.
No, that was a long time ago. It was over 10 years ago. It would have been Lisa that we trained with.
Okay. Not sure who that is.
I don't even know if she still does training, but then I was over in the Lincoln Center in New York and did some training over there.
Oh, wow. That's amazing.
They were the sort of the founders of the NADA protocol, so that was interesting. But now I'm working in cancer services and I'm trying to get them to bring it in, but they said the insurance is too high. So
really, because as you quite rightly say, NADA in itself has a really wide evidence base. So are you linked in with Beverly de Valois?
No.
So she's a NADA researcher, and she's brought NADA into cancer care. So she'd be a really good one for you to link in with. Are you on LinkedIn?
No, I'm not. What's her name again? I'll find her.
Well, I could link you up if you wanted to. Are you on any social media? I could tag her in.
Facebook.
Okay. What's your Facebook name?
I think it's under Patsy McDaniel.
Patsy McDaniel. I'll try and find you. Okay. All right. I'll link you in. So it's Beverly, and then new word DE, and then new word Valois, VALOIS. So she has just rewritten the acupuncture guidelines. She's a body acupuncturist. She's a NADA acupuncturist, but she's also a doctor, and she's also a researcher. And she's done a lot of research. If you go to NADA GB website, her stuff is on there.
All right, I'll find her there then.
Yeah, her articles are on there. Her research is on there. You can download her new guidelines. But she's a person that will help you get that into cancer care because she's done the research.
Yeah, it is in one of the cancer charities, but the reason that ours wouldn't take it on the insurance too high, but I'm gonna push it again, you know, because it's treatment, not to be using it.
So I not long ago trained somebody from Macmillan in NADA because I'm a NADA trainer as well. I'm going to talk about Dr. Michael Smith in the Lincoln and talk about. I'm going to mention him and some of his wisdom.
Yeah, we met him when we were over there.
Oh, did you? Oh, I'm so glad I've met you today. This is a wonderful link. I'm so passionate about NADA. It's amazing. Have you been to any of the conferences?
Yes, we were at one in New Orleans. That was a long time ago, but and I was at one in Dublin, and then I when I was in New York, I trained as a NADA trainer, but I haven't really been involved in it so much in the past maybe 8 years because I'm working with cancer services now, you see.
Yeah, but it's very linked in. It's so those days of it just being substance misuse and addiction, obviously that remains. But like Kaiser Landgren, I'll talk about her as well. She's done a lot for NADA and mental health. She's got a book. Actually, I think I've left the book at home. That's a shame. I'm just going to let somebody in. Hi, Linda. Don't know if she can hear me. Hello, Linda. You okay? Hello. You all right, Linda? I'll just give you a minute to get yourself sorted, Linda. So Kaiser Landgren, she's done a lot for NADA for mental health, and she's written a book. Hi, Linda. You okay? I don't know if you can. Thank you. Thanks for joining. And her book is on NADA for mental health, and she's got really high-grade evidence. Beverly DeValoy has really high-grade evidence for NADA as well. And NADA GB in London, every few years they run a conference, and like Kaiser was there, Beverly DeVoy was there, so they're all presenting their research. I appreciate Dublin might be a bit closer for you, but that will run every 2 years. But this year the theme was, it was October, so last year the theme was Unimagined Bridges. So that's the title of, I don't know if you've ever watched the NADA film, when they did about Grenfell and Twin Towers. The title of the film is called Unimagined Bridges. So they named that as the theme of the NADA conference in October. And, you know, there's just what's so astonishing about NADA as well. Sorry, Linda, we're just talking a little bit about NADA because Patricia's trained in it. There's people who deliver it on the ground, but also you've got like professors, gynecologists, researchers, got really high grade evidence, which is really hard to get within ear acupuncture generally. And the reason why we've got that high grade evidence is often coming from the hospitals. So that's where they're getting their funding from. That's where Kaiser's done hers, and that's where Beverly has done hers as well. So I have a good scout around the NADA GB website.
Yeah.
And you'll find a lot of stuff. And also, actually, Patricia, the recordings are on there from the conference as well.
Oh, okay. Yeah.
Yeah.
Maybe I'll make it this year.
It'll link you back in with it in a wider scope than just addictions. I learned it in addictions myself. I'm going to talk about that. So a lot of this will resonate with you. So I'm going to make a start. If anybody joins us, I'll let them in. I thought I'd let my settings so you didn't have to ask to be let in, but I'm not sure why. Okay, so I'm going to record this. Is that okay with you both?
Yes, absolutely, yeah. Is
that all right with you, Linda? I'm not sure if you found.
Yeah, that's fine. No problem. Yeah, no problem.
Thanks. Okay, so there's only two of us at the moment. Two of you at the moment. I'm going to make a start because I realised that is it yourself, Linda? You got somebody booked in at 11. Is that you? No, might be someone else. Okay, I'll make a start anyway. Okay, bear with me. Let's just get back onto the view. So, do you two just want to present, just introduce yourselves?
Yeah, okay.
And Stephanie's coming as well. And just say where you're from and what therapies you practice.
Is my camera not turned on?
In the mode that I'm looking at the moment, I'm not sure because I'm between screens.
All right.
I can't see you. I can't see you. Can't see you. Hi, Stephanie. You okay? So I'll just give Stephanie a minute to get sorted. So Linda, where are you from?
I'm Oxford.
Ah, wonderful. Okay, not too far. And what therapies do you practice?
Predominantly sports at the moment, but just massage predominantly. I do a bit of reflexology, Indian head, that kind of stuff. But yeah, mainly traditional massage at the moment.
Amazing. There's a lot of parallels with the ears and the feet being microsystems. So I know that Patricia is also a reflexologist, aromatherapist, Reiki, sports massage too. And an ear acupuncturist as well. So there's lots of crossovers there. Stephanie, are you able to just unmute yourself for a minute and have a quick chat?
I think I worked it out.
Yay! Oh, technology, it's wonderful, isn't it, when it works?
Yeah, exactly.
Where are you from, Stephanie?
So I'm from Bedford, but I've just recently moved to Kendal up in the Lake District.
Oh, how wonderful.
Yeah, it's lovely up here. Even though it's raining quite a lot, but you know.
Yeah, it's tipping it down here today as well.
Yeah.
It was lovely yesterday. And what therapies do you practice?
So I'm a complementary therapist. I mainly kind of tailor all treatments, and then I do reflexology as well.
Oh, okay. When you say all treatments, what do you mean?
As in, like, all my clients that come to me, I will tailor the treatments for them. So I'll just use a variety of techniques rather than like a set deep tissue session or Swedish or whatever.
Okay, so you'll do massage as well. Amazing.
Massage, yeah.
Fabulous. Hi, Catherine. Welcome. Thank you. Thanks for coming. Where are you from, Catherine?
I'm in Sunderland, so I'm a bit late. I've just got back from a networking meeting.
Oh, no worries. That's okay. Did you say Sunderland?
Yeah.
Amazing. And what therapies do you do?
Sports massage, pregnancy, cupping therapy, hot stones, dry needling.
Wow. Okay. Lots then.
Yeah.
Okay. Fabulous. So lots of you on here. There's so many parallels. I like to try and tailor it to what therapies you do, just to draw some analogies. And lots of you do sports massage, it seems, and also the reflex as well. Amazing. Thank you so much. Okay, I'm just going to make a start. So thanks for joining me on this very dreary, rainy day. So I'm going to introduce you to some new ideas about the ears and help you engage in something that I call ear talk. So becoming attuned to ear talk is the title of my new FHT accredited online workshop. So did you know that the ears can be used as a window to the brain, as Muriel Agnes says, and they can easily enable us to access nerves such as the vagus nerve and the deep regions of our brain and actually change our brain chemistry. Now that might sound a little bit far-fetched, but it's actually one that we can scientifically and clinically evidence. We've got the functional MRI scans of Romoli to show it. So knowing how to change our physical, emotional and mental health when informed by visual inspection of the ears, because that's what we're going to be talking about today. And also ear assessment and ear reading. So we assess the skin alterations the anomalies, the manifestations that appear on the ears, and we look for the most tender part of the areas and zones on the ears. They help us find the most active acupuncture points. We don't have to apply needles. We can use other things, which I'm going to talk about. So this is just a little vignette really of my larger, fuller 2-day course, which deals with the visual inspection and the ear assessment to indicate health, and it is evidence-based as well. So hopefully we'll spend the next hour or so connecting about feet and ears and other body parts, because we're all therapists here and some of us body acupuncturists too. So the reflexologists amongst us will be familiar with Eunice Ingham's book entitled Stories the Feet Can Tell, Stories the Feet Have Told. So I'm going to similarly tell you about stories that the ears can tell and that the ears have told, if we learn how to listen and make sense of the information that is given to us. So I'm going to show you some images of lots of ears, but I'm going to introduce to you a picture of my ear. And I'm going to talk to you about this concept of our medical file being imprinted onto the ear and how we can tell about our past, present, and future. And I'm also going to introduce you to some people that I've been lucky enough to work with along the years, patients that have taught me a lot. And those are within my background is addictions and mental health. So I'm going to talk to you a little bit about those people that I've met as well. I'm also a reflexologist and aromatherapist and an ear acupuncturist too. So we've all got acquainted. We know where we're from and we know the different therapies that we work with. Some of us are body workers. So I just want you to just have a go in the chat. Just tell me, when you work different areas of the body that you're used to working, so the feet, the ears, the body, what information can we glean, discover about our patient's health? So, for example, it might be on a physical functional level, but it might be on an emotional level as well. What health states and conditions might we get an insight to? If you just pop that in the chat for me. And if I could ask a big favor, because it's really hard for me to present and keep an eye on the chat, because I have to keep coming out to different screens. Could I have a nominated person who could just feedback the chat for me? Would that be okay? If you just verbally tell me some of the things that people are saying. Does anybody like to volunteer to be my chat feedback person?
I don't mind doing that for you, Anna.
Thank you so much. Who was that?
Catherine.
Thank you, Catherine. Thank you. So just pop into the chat then. Just share some ideas. What information can you glean when you're working people's bodies, their ears, their feet? What information can we tell about people? And it could be on a functional level, a physical level, an emotional level, a spiritual level, because we're treating on all different levels. I'll give you a minute. Oh, it has popped up. Energy levels, absolutely, yeah. And that people's energy, yep. So we can stress and tension, yeah, definitely. How much stress they're holding in the body, particularly when you're working with fascia, that holds on to that, the emotion, doesn't it? Trauma in particular, definitely. So it's a similar thing with the ears. So we can work energetically, absolutely. Patricia, I totally agree with that. And we can have different perspectives, like a TCM perspective and also a Western perspective with ear acupuncture and auricular therapy, because we can also work on meridian lines and energy lines, as well as more Western phenomenons of neuromodulation. So thank you for that. Guarding physically and emotionally, absolutely guarding, holding it in. And that's when we often get those releases, don't we, when we work with people where they can have those emotional crises and those healing crises. We know that's a good thing. They don't always understand that, but sometimes one of the only ways that we can do that is through working the system, hacking into the nervous system, and not necessarily through talking therapies. That can come at a later time. Thank you. Thank you, Catherine. It did actually pop up, so I managed to see it. Thank you. It was kind of you. Wasn't sure if that was going to happen. So here is an image of my ears. So we're presenting this concept that the ears are record keepers of our medical file, past, present, and future. And that's an analogy that's introduced by Dr. Oleson and Huang, who is, I'm going to introduce you to as the mother of auricular therapy, auricular medicine. So the record keeper of my medical file are presented as skin alterations or anomalies on my ear. So if we take a look at the ear for a minute, and we're looking at, same as with the feet, we're looking at colours, textures, red parts, white parts, and you should all have got your discoloration chart that I sent through. So we're going to be using that in a minute. But I just want to show you something. So if you look at my past medical history, so I've undergone organ removal of my gallbladder, and I've also had my appendix out. So those are shown in the blue circles, which represents the past history. And what you can clearly see in my ear, in my upper concha, so the upper concha is this part of the ear here, is you can see this white scarring on my ear. And I also have indentations or depressions. And it's only on my right ear, not my left ear. Obviously, your gallbladder and your appendix are on your right. So it is corresponding with what's going on my body. So one thing that's really fascinating to me, and I don't know if you've ever noticed this as well, is that when people have scars on their body for surgery, have a look on their ears and see if it corresponds in the same area on the ear which is represented. I'm going to talk to you about the ear map in a moment and just talk you through where things are represented. So I've got this white scarring here where my gallbladder, my duodenum would be going on to my liver area. It's quite a large area, and it is an area, not a point, at the same side as where my organs were removed. So if we think about very briefly Naugé, Paul Naugé introduced this concept. So just really, really crudely speaking, it's the map of an inverted fetus. So the head is here on the earlobe. The spine curves round right to the top here. So this would be your neck here. So cervical, thoracic, lumbar, and then sacral towards the end. And then because everything's upside down, you've got your upper digestive system here and your lower digestive system here, and your hepatic system is there as well. So that's indicative of my past medical history. So that was in 2013. If you look at my present, so in April of 2025, I had 15 gallstones that were stuck in my bile duct. So there's still an issue for me. There's still something going on within my hepatic system. Obviously, I don't have a gallbladder or an appendix. So I had 15 gallstones removed. I also had my appendix removed in 2023. So that was 10 years after the gallbladder. In my present history, so you can see the green box towards the top here. So towards this part of the ear here, this is where the feet took up, and this is where the pelvis and the area is, and also the leg. So we've got hip, knee, going to ankle, sole of the foot, and toes are going along here. So where you can see quite high in the ear and the triangular fossa, this part of the ear where you can see that green box, I have hip dysplasia, and the hip point on the here, there's actually two hip points because it's a Chinese system and there's a Western system, one's higher and one's lower. My hip dysplasia is showing by very long reticular, what we call telangiectasias. So have a look at people's ears and you'll see these dilated blood vessels. Always see them around the joints if they've got joint problems. And then in terms of my future, you can see the red circle towards the bottom in the lower concha here. I've got this massive white patch here. Now, this area on the ear is actually the lungs, and there's nothing wrong with my lungs. I'm asymptomatic. So I've put a big question mark by this because I'm not sure what is going on with my system. But one thing I do know is that the ears are indicative of health, and that they're usually pretty accurate in telling you what's happening. So when I was using Nourget's map to try and figure out my lung area here, I'm thinking, well, that doesn't fit because I don't have any lung problems. I looked at a different chart, which Dr. Barr chart. So he's the German system. And he calls this part here on my lower ear, where the lung point is the liver center. So I thought, that fits. So it is confusing sometimes to use different charts, but that kind of fits with what's going on. Or maybe there is something else going on. Who knows? So it's a very interesting concept to think of your ears as your medical file that are showing an imprints of your past, present and future. So this is Paul Nourget's inverted fetus map. This is a very early drawing. So he propelled the history of modern European auricular therapy away from the traditional Chinese perspective. So one thing I want to make very clear is that ear acupuncture and auricular therapy is not new. It's been around well over 3,000 years and documented in lots of Emperor's books, Emperor's books and drawings, all sorts, Persian. And the Oriental, I say Oriental because it's also, Korean, Japanese systems. They used to use ear acupuncture and auricular therapy on the lines of meridians and energy lines, Patricia, which you were talking about. So then in 1956, Paul Nourget introduced this concept of the inverted fetus map, which I've just rather crudely explained to you. And this is what propelled auricular therapy away from the traditional Oriental use of it, because up to this point, there wasn't an anatomical map. And what happened was Paul Nourget discovered a sciatic point on the ear, which was here, which was in number 5, sacral 1 point, just off the edge of the antihelix. So Paul Nourget was a French neurologist, and he kept seeing cauterization marks on the ear. So cauterization means a burn mark. And he discovered this burn mark on the ear. And he asked everybody, because people that were coming to him to be treated for sciatica all had it in the same place on the ear. And they all said they've been treated by the same layperson, which was a lady called Madame Bavrin. She wasn't a doctor, but she'd been cauterizing, burning people's ears at L5S1 on the antihelix here. So the antihelix is our spine. She was taught by her father, who was taught by a Chinese national. So that information got passed down from Chinese. So he figured out, okay, if that's the sacral spine there, and then this must be like the cervical spine, beginning of it. And then that's how he figured out the map. And we've got all these brain points here, just from that sciatic point. So it is a really interesting concept. And once you see that image of the inverted fetus in the ear, it does kind of make absolute sense as to where anatomically it can be found. So what we can do is we can use our charts. I have plenty of other charts which I actually teach on my course, but like you've got your discoloration chart. We can use that to look at the colour, the texture, the skin anomalies that appear. And what we would do is we'd look at what area it is on the ear, just like we would in reflexology when it's a person upright. This is obviously inverted. And we would look to that corresponding area to try and figure out if we're treating on an anatomical level as to what area that might be on that person's system. And it does tend to follow the pathology on the left and the right side, although you do have crossovers. So this is an image of Dr. Raphael Nourget. So he is the son of Paul Nourget, who discovered the anatomical map in 1956. He uses a red hot paperclip to cauterize the ear. So he burns through the skin about 1 second, doesn't burn through the cartilage, just the skin, to treat sciatica. And that still happens today. So even though it's quite an ancient practice, it is really interesting. If you look at the history, they actually used to cauterize ears for contraception, as well as sciatica. Point here, which is really typical when people have their ears pierced. That's the eye point there. Mediterranean sailors used to use that point to improve their eyesight. So there's a lot of history behind it. So you can see this person's got a very clear cauterization mark and scar. They'll have a scar on their ear. So this is your progressive discoloration chart, which you might want to have handy because we will be using that very shortly. But what I wanted to do is not just tell you about skin alterations and how we assess the ears. I wanted to put it into some context of some of the real ears and the real people that I've been working with within my clinical background as a specialist drug treatment worker. I'm also a specialist social emotional mental health teacher, but my background is mainly mental health and substance misuse, which is actually where I learned ear acupuncture, and that's what propelled me to want to go on and discover other protocols. So over the last 25 years, I wanted to talk to you about how I came to understand and interpret meanings and indications for mental and physical health through the visual inspection of the ears and the thousands of auricular therapy and auricular acupuncture treatments which I have delivered, which have had very powerful and very astonishing results, and they still astonish me to this day. And there is a massive evidence base behind auricular acupuncture and auricular therapy as well. This isn't just plucked out of the sky. But what I really want to get across to you is those little moments of magic that I experience using auricular acupuncture and auricular therapy. We don't have to use needles, and how it changes people's moods and states physically, emotionally, changes brain chemistry. We know that neuromodulation happens when we press on certain points on the ear. We can palpate on the ear, we can use a probe, and we can also use our fingers. We can use ear reflexology. We could use a pen with the biro took out. We know that all of these have a really powerful effect, but I just have to have a bit of a disclaimer as well and just say I'm not being diagnostic here, but I am being evidence-based, because one thing I've learned is that the ears don't lie. Even sometimes within the system, when people aren't showing signs, if you look at the ear will tell you what's going on, and then later sometimes that will show up in the body. Dr. Oleson and Huang says that things can often pathologize in the ears first. So some of the people that I've trained with and who I'm kind of synthesizing their knowledge today, Terry Oleson. So he's created this amazing, this is kind of a bit of a Bible for auricular therapy. I've trained with him. And also Dave Mabey of the Canadian Institute of Auricular Medicine. I've done quite a lot of work with him, particularly around trauma. Amanda Shell of AcuRegion, John Tyndall, Yuan Clinic, Nada, Rachel Peckham and John Bake, Korean ear acupuncture and auricular therapy. But most voraciously, I've studied Romoli and Oleson and Huang. So this is one of Dr. Oleson and Huang's books here. And also this the Romoli one. So even though within acupuncture world we call it auricular diagnosis, I don't use the term diagnosis, I use the term assessment, so ear assessment. So I originally trained as a reflexologist aromatherapist in 1999. I'm accredited with Association of Reflexologists and CNHC. And then quite early on into my career, somebody asked me if I would be willing to work in a Birmingham-based substance misuse service with young people. Now, I didn't know anything about supporting adolescents with drug and alcohol use at the time. In fact, I was really interested in working with people with eating disorders. But since that wasn't on the cards, I decided to give drugs and alcohol a go instead. I became lead complementary therapist at Birmingham's only young person's drug treatment service at the time, called Birmingham Higher. It was a really unusual service because it was cutting edge and it was so ahead of its time. So the Higher stands for Holistic Innovative Approaches to Health. It was multidisciplinary, and it really heavily relied on complementary therapies within and alongside a medicalized model, which is highly unusual. and often the complementary therapies were really valued and used by a lot of stimulant users and cocaine users, where there isn't any substitute such as methadone or Subutex or anything like that. So I was lucky enough to work with some amazing people, and some of the students the clients that attended, young people, you know, as young as like 13, 14, they absolutely loved the reflexology and they loved the ear acupuncture as well. But in 2002, Higher Commission John Tyndall from Yuan to train us in a Birmingham worldwide auricular acupuncture protocol called NADA, National Acupuncture Detoxification Association. We're really lucky enough to have Patricia on here with us. Patricia, please do share your insights. Patricia actually went to the Lincoln Hospital Centre, which is in New York in the Bronx, and trained and met Dr. Michael Smith. So Dr. Michael Smith kind of brought NADA to the Western world. John Tyndall went over as well and trained with Dr. Michael Smith and then brought it back to the UK. Dr. Michael Smith did learn it from Wen, who was Chinese. But some of his wisdom and the nuggets and the philosophy that he presents to the idea of auricular therapy they're just pieces of gold. Because what he says is because acupuncture can take the most panicked person and show them a peaceful side of themselves in about 30 seconds, you're able to reveal this important human and spiritual lesson right away. People think because of the fast-acting nature, because we're going right from the nerves that are in the brain, are innervating straight into the ear, particularly the vagus nerve. People think there's something in the needle. There isn't. So he says, you know, there's nothing good in that needle, so there must be something good in me. Something good in me, something peaceful, something quiet, something forgiving, something optimistic. So when we use auricular therapy, we know that it gives people that private, quiet space that hacks into their nervous system and calms them down and relaxes them. We absolutely know, and I know that from treating thousands of patients as well. And what really struck me when I began using the ear acupuncture was how quickly people became relaxed and calmed down. Obviously, I was working within a drug service in that setting at the time, but the use of it is very wide, and I'll talk about that soon. But because I was working with ears and so much, I began to notice some really weird and wonderful things on the ears, some creases. If people have got double tragus here, where they had creases on their ear, where they've got their wrinkles here on the ear, which can indicate a shrinking of the brain and dementia. Obviously, I'm working with young people. At the time, that's more something that you see with older people. You see these broken blood vessels, you see patterns of them. But people were telling me that not only did they look better, because, you know, there's certain points in particular when we're treating the lungs, in Chinese medicine, that's linked to the skin. So they look better, but they used to tell me that they felt better as well. And then it was witnessing this fast acting, changing people that continues to propel my desire to spread auricular therapy and auricular acupuncture treatments and continue to teach it as well. So I want to introduce you to Joshua. So during my time at Birmingham Higher, we were trained also in psychosocial interventions of the moment. So motivational interviewing, solution-focused therapy. So, you know, we were training in these 20, 30 years ago. They've kind of come back around and now they're therapies of the moment. Particularly, I noticed that one professor's using them with them ADHD. But this was our bread and butter. And I'm not saying that talking therapies aren't useful. They absolutely are. And I like to use them alongside ear acupuncture and auricular therapy. But I knew that the therapies of the aromatherapy and the reflexology that I was using to support young people was effective, but it was an absolute game changer when I added in the auricular acupuncture to the mix. And this is what I want to try and get over to you. you don't have to use needles. You can look at people's ears, you can look at their visual assessment and visually inspect them and use that alongside the treatment modalities that you already have. But one particular young person, Joshua, that's not his real name, he stays in my mind because I loved working with him. And he used to make me smile. So he would come without fail for ear acupuncture 3 to 4 times a week with his imaginary dog, who he would whistle and call. And he used to like to set fire to things in his own home. And so he was removed from his home and he was actually in care. He was, when he received ear acupuncture, he used to go into very, very deep, relaxed state. And I distinctly remember him because one day he asked me, have you ever actually thought about setting fire to your own hair? And, I gently told him, no, I hadn't. But of course, I hid my surprise when he asked me that. And quite clearly, Joshua had some mental health difficulties and he was trauma experienced. But what's really humbling is the trust that he gave me. There's somebody who was clearly quite damaged, and we're dealing with people with trauma histories and touch histories that aren't always positive. And they hand over that their own power and trust you to touch them and to treat them. And one of the things I just want to get across to you is how Joshua presented on paper, his profile on paper, was not the Joshua that I saw. So, Josh, I don't know if somebody might just want to mute themselves. So on paper, Joshua says he was age 14, he was an arsonist, he was in the care system. He used amphetamines and cannabis. He also used alcohol a lot as well. He had his imaginary dog. He always brought with him 2 appointments. He was very restless. He was always pacing, very agitated, found it hard to settle, and he had a very fast, pressured speech. But when I looked at Joshua's ears and, of course, got to know Joshua, this is what I saw. I have experienced trauma. I am dysregulated. I experience high moods, then crashes. I have skin alterations on and around my antitragus, which is here, my brain stem, my occiput, my hippocampus, my amygdala, my cingulate gyrus, which is the limbic part of the brain, and my nervous system via the vagus nerve requires activating. My system is depleted and is showing a lot of heat. Could somebody just mute themselves, please? Thank you. So his ears told me what was really going on with him. So, over and above how he presented on paper. So Joshua's ears might have looked something like this. And I've put in an image of a real ear alongside one of Romoli's, which is taken from this book. And this links to mental health and where we can visually inspect the ear around the antitragus, just here, which is where all these brain points are. Remember that the lobe is the head. And we find specific ear anomalies for depression and insomnia here. But also, if we want to just have a look at Joshua's ears and a depiction of what that might have looked like. And we're going to need a progressive discoloration chart if you've got that handy. So if we just have a little look at Joshua's ears and the image of that on your screen, what is the first thing that we notice about the ears in terms of the colour? You can just answer out loud or you can just pop it into the chat. What do we notice about Joshua's ears? What colour or colours do we see? While you're doing that, I'm just going to grab my probes for you just to show you. Sorry. Okay. Any ideas? White dot pink, Linda, thank you. Yeah. Did I miss anybody else? Catherine in the chat, sorry. Any other colours? We've got white bits, we've got pink bits. What colour just really like stands out like a beacon, a really clear signal on this person's ears? What do we notice? What colours? What colour in particular? I'm not sure if somebody's put it in the chat already. I'll give you a moment. If you use your
the white and the dark pink is what Patricia and Linda have said as well.
Absolutely. So that dark pink is actually an acute red. It's a really bright red. I'm not sure how that's come across. Thank you. On the image. And that's something else to let you know as well, actually, and it's a really good point. When you're inspecting people's ears, or if you are palpating using your probe, we can even use golf tees as well, or we can take the fire out of a pen. But I mean, a probe is preferable, it's better. Always visually inspect them before you wipe the ear, because as soon as you wipe the ear, it changes. And also sometimes the light that we're in and the flash on the cameras can change the presentation of the ear as well. So try and visually inspect the ear in natural light before you wipe it. So that bright red screams, I've got inflammation in my system. It screams, I have heat in my system. Heat is called yang rising in a TCM perspective. Now, my experience of yang rising, when I see people see as bright red like this, is I can think of it on an emotional level. So it's yang rising is anger, frustration, agitation. I used to see it on people, crack users, stimulant users, amphetamine users all the time. So this would be something quite typical that you would see. Could be people with high blood pressure, could be acute as well. So the point is, if it's bright red like this, you know it's happening now. This person is probably in pain. When you see this bright red down here, this is called the scaphoid fossa on the ear. And it's got this scaphoid means boat shaped. Okay. Tragus means hairy part of the ear. When you understand the Latin, then it really helps you to remember. So if you've got bright red in the scaphoid here, which we have here, that indicates to me joint pain usually. But what we see around the antitragus and what Romoli is showing us here is we can notice these creases, particularly around the occiput point here, the occipital, the autonomic nervous system point here. We get these creases here. That's really typical of people with mental health issues. Also, we see on the picture of Joshua's ear here, along this part, so we've got this bright red, which is kind of towards the outside. So the bony protrusion here is the vertebrae, and then we've got the muscles either side it. What do you notice about the colour? So we've got those white pale bits, as you say, and then the pink bits and the red bits. What about this colour here on the this part of the ear here going up into the...
There's a slight yellow into it.
Yeah, there's a yellowing to it. It's a light brown colour, isn't it? So have a look at people's antihelix, because antihelix is, musculoskeletal, it's the spine. And if you see this light brown colour, because if you notice that the chart goes from like a acute red all the way through to black, as people's systems begin to clear and heal, you'll notice the colour changing, in going to brown, light brown, then darker brown. So when you see brown here, it means that they've had a back problem, and it is very specific. It will pinpoint which part of the back, just like you can in reflexology, you can pinpoint the vertebrae. So this means that he's had a thoracic back problem, but it's healing. The bright red means acute. So it could be emotional, it could be functional, it could be pain. But look around, you notice the antitragus here, and usually where it comes down here onto the lobe, as it does in this picture here, you usually find that in people with mental health issues. And then see the white. White means lack of blood flow as well. So you can see that you'll often find it on the neck area, or you'll find it along the spine. Look on the spine. You'll notice a massive difference between where it's bright red and then it's white, showing a lack of blood flow getting to that area of the spine or the neck. We need to really think about the nerve innervations, which I'll show you very shortly. Was that interesting to you? So much we can tell by the colour of something. Thank you. Okay, so the analogy of the ear as being a computer terminal partly explains what was going on for Josh. So if we imagine that the external ear, so this part of the ear is a computer screen where we see what Oleson calls diagnostic signals. So we're going to call them skin alterations or anomalies or manifestations. So we can look at this as our screen to see what's going on in the ear, in the brain, because remember, the ear is a window to the brain. So when we type a message using the keys on the keyboard, so how are we typing a message? We might palpate with our probe, we can scan, we can tender test, we can find the most sensitive parts on people's ear. That's usually the most accurate acupoints. We can press with our fingers within reflexology. We can use a golf tee. We can use seeds. Got a little one on there to show you. That's just on a little plaster. That's a vicarious seed. You can get loads of different kinds of magnets and beads, and gold and silver and crystal and pearl. This one's a vicarious seed. So when we press on our keyboard, we're actually sending a message to the brain. We can also use electrical stimulation as well. That's often used within vagal nerve. Electrodes can be added here to the antitragus. Vagus nerve, there's actually 3 vagus nerve points on the ear, one of them being here. Anytime that you are massaging, innervating into the concha here, you're actually accessing the vagus nerve, you're accessing the parasympathetic nervous system and putting the person into relaxation. So this analogy of the ear as a computer screen and keyboard is one that Oleson and also Raphael Norgier talk about as when we press a button on the keyboard, that it's going via the central nervous system, and Raphael Norgier says the auricular hormonal changes happen, and they enable us, according to Raphael Norgier, to treat pain, functional disorders, addictive problems, and minor psychiatric disorders. And that's just the start. You know, there's some very high level systematic reviews taken place. We know that there is this point-for-point correspondence between when we press a certain part on the ear, that it relates to that part of the brain that's involved with the functioning. I'm going to show you a functional MRI scan just in a moment. So NADA, Patricia knows about NADA. The NADA is what I introduced to you with Dr. Michael Smith, who was talking about how fast acting it is. Beverly DeValoy is involved in cancer care. She has done some excellent high quality research on NADA used in cancer care, and also Kaiser Landgren for eating disorders and mental health as well. Their research was both done within hospital settings where often they have the funding. So I moved on to adult drug and alcohol treatment service in the NHS, working for Birmingham Solihull Mental Health Foundation Trust. And I worked as a specialist drug and alcohol treatment practitioner supporting patients with Class A drug use and also offending. And I was lucky enough to be able to train in many psychosocial interventions, including cognitive behavioural approaches. And I provided the Birmingham-wide ear acupuncture service to support hepatitis C and HIV patients as well. And I treated the commissioner alongside the patients. Auricular therapy is an equalising, levelling treatment. It takes away any hierarchy or power dynamic. Farah Idris, who's another NADA trainer, alongside myself, I'm a NADA trainer, she calls it a democratizing group setting. And I used to offer the commissioner, when he came, condoms too, just like the patients as well, to just really ensure that we had that levelling effect. And when patients used to present within drug services and mental health services, they're so entrenched in being in multiple services and usually spanning many decades. And they were required to tell their personal stories and their personal histories over and over again, including their trauma histories. And often their function of use within drug services and alcohol services was to mask emotional pain and trauma. And they became just another case number. And the search for the good person, as Dr. Michael Smith put it, often became forgotten and visible as they became engulfed in these services. But here comes the magic. Auricular therapy makes no demands on the patient or the client. It's a non-verbal treatment. It does not require any removal of clothing. It is only a private, silent balance of body and minds that is triggering the person's own system that has the ability to reach homeostasis, absolute balance. So auricular therapy, including C's, were a lifeline to stimulant users and to crack users. And I want to introduce you to Paul. So Paul was a very prolific crack user. And often when stimulant users presenting services, they're presenting with very poor concentration and focus levels. You've got them for about 15, 20 minutes, if that. They're very restless and frustrated and agitated. And Paul was somebody who used to come regular for ear acupuncture, and I treated him within the drug intervention program, which was a hugely successful national program that massively reduced crime and helped people hugely in terms of their recovery from drug use, certainly in terms of their stability. And Paul was having use and his cravings, and he tried to help me understand the grip that his crack use had on him. And he used to say, take your best orgasm and times it by 100. That is what crack is. Thinking, well, how the heck can I compete with that with my auricular therapy and my auricular acupuncture? But I set to work to attempt to do so. Josh is here. We saw the heat in the system. We can treat it on an emotional level, and those colours, that red hue, can also indicate this yang rising within the system. His Shenmen point, which is here, Patricia will know about the Shenmen point. Shenmen means gateway to the spirit. It's a really calming point. I've just got my finger on the acupuncture needle there that's in the Shenmen point. Shenmen showed me that he lacked calm. His liver, which is over here, was really compromised and probably linked to the emotion of anger. So in traditional Chinese medicine, we can link points to emotions as well. His stomach starts here and it actually goes all the way across to the liver point. Can you see that long broken blood vessel that Paul has got on the image there? That's going all the way from the stomach right across to the liver here. His digestive system, so remember you've got upper digestive system in the lower concha and the upper digestive system here the lower digestive system here in the upper part of the concha. His digestive system is showing that. Look at the different colours of it. It's a little bit black, isn't it? I know we've got those shadows and I know we've got that darkness, but we've got those anomalies really clearly here. Also within the lung area, can you see the brown nevi? He's got a nevi here as well on his antitragus. So his ears are showing that he's depleted, that he's yin deficient, that his liver is compromised, that his digestive system isn't working properly, he's probably constipated. And this linear telangiectasia, that's that broken blood vessel that's going along here. So this is obviously a picture of somebody else's ear, but the picture of this person's ear, it was actually somebody who was using drug and alcohol very prolifically, had a very long, prolonged history of drug use. You don't have to have a history of drug use to be seeing some of these signals diagnostic signals, as Oleson calls them, or skin anomalies, as I call them, on the ear. So look out for these long lines here, these linear lines of blood vessels, because those are what telling you that this is areas of dysfunction. So I couldn't quite compete with the euphoric effects of crack that Paul gave, but I did come a close second. And this is how he told me that auricular therapy made him feel. He gained a sense of calm and release. He had a better night's sleep, clarity of mind, reduced cravings without substances for the first time in decades. And of course, he used to come regularly for treatment. So you don't even have to stick needles in people, though it is fantastic if you're trained to do so. But you can just use fingers, you can palpate. As I've mentioned, you can use probe, and you will make a difference to people that you see. And always use the ear as final guide. Look for the anomalies on the ear, and the ears will tell you what is happening with that person. So what we know was happening with Paul is what Muriel Agnes describes auricular medicine to be, and that is a window to the brain. She says a gateway to whole brain happenings that make the structures and functions of the person visible. And if they are visible on the ear, like I like to think of them as footprints in the sand, and remember going back to that earlier picture of my ear where we've got imprints of my medical file, what Oleson calls diagnostic signals, then we can read them, and not only read them, but gain feedback from them through the palpation, through tender testing. We ask the person, we can do pressure test, we can do tender test, ask the person, can you tell me which is the most tender part of the ear? Because then that informs us to be efficient and accurate, and when we can then effectively access neural pathways and make changes in deep regions of our brain, and ultimately impact the health status of the patient and support them. Romoli et al., they've done some functional MRI scans, and here is an image of them now. I mentioned to you before about this point-for-point correspondence, and that's what was happening in this piece of research that's done here. It shows the specificity of where we palpate or stimulate or stick a needle in the ear. Actually, no problem. Thank you, Pat. I'll send you the recording. Actually, there's a point-for-point correspondence for it within those regions of the brain that are responsible. So in this piece of research here, he used 2 points. He used a brainstem point, which is down here on the antitragus, and he used a thumb point, which is up here. And we saw that certain parts of the brain are activated and deactivated when these points are stimulated. So the anterior side of the brain, the ear, the front part, deals with the motor functions. So that's very much activated when the thumb part of the acupoint here was stimulated. And so with the brain stem here, so we know we've got this point-for-point correspondence. So I like to think of us palpating, stimulating ears and reading ears as nature's functional MRI scanner, enabling us to see the projections of the brain and body onto it. So like a hologram, that inverted fetus pattern that Nourchier presented to us in 1956 is the brain's organization of how it perceives the brain itself and the body to be. So Dave Maybe from the Canadian Institute of Auricular Medicine, he talks about how we can make the brain become reorganized, particularly when we're treating with trauma. We're effectively facilitating neuromodulation, and he says we are removing energetic blockages by stimulating the nerve endings on the ear. Now, you think about patients that you treat, clients that come to you. Imagine if you can actually change their brain chemistry, the organization, the patterns of their brain, what a difference that will make to you and to the patients that you treat. You may have heard of Bessel van der Kolk, really wrote the book The Body Keeps the Score. He says trauma lives in the body. We spoke about that right at the beginning. We spoke about how it holds on, somebody said, to trauma, to the emotions. So he is talking here about the need for somatic therapies. So these are the therapies that we do in place of higher thinking, talking therapies at certain times of people's trauma response when they need another way other than talking therapies at that particular moment in time. So I'm not talking against talking therapies. I'm talking about sometimes people need a different response when their systems need a different response. And he's talking here about how we can tone the vagus nerve. And he's saying it's not about talking, it's about activating your system. When you're frozen, you're shut off. Awareness of your body states, and basically what you need to do is get the body to be alive and reinstate the signals between the body and the brain. You can do that by singing and breathing and making sounds. And that's him talking about toning the vagus nerve. And we know we can also do that through auricular therapy, because what we're lucky enough to know when we're treating the ears, that the vagus nerve is one of the only places on the external ear that it innervates just under the surface of the skin. So one of the master vagus nerve points is here, just near to the ear canal. There are other points as well. A vagus nerve is the longest 10th cranial nerve, and when it's stimulated, it puts us into rest and repose. So it activates our parasympathetic nervous system, really easily accessible here. And sometimes a really nice thing as well, if we can be really accurate by accessing it and the 3 points on the ear, but also if we're less concerned about accuracy, we know any time that we stimulate the concha, upper and lower on the ear, because the vagus nerve comes in like this, it innervates at the tragus here, and it does overlap with the other nerves as well, because you've got the trigeminal towards the top, and then you've got your cervical plexus innervating here at C2 and C3, which is there at the neck point. We know as long as we're stimulating in anywhere in the concha with our fingers or otherwise, that we are activating our vagus nerve, our parasympathetic, and we are putting ourselves into relaxation. And we can do that through ear massage as well, just by pulling the ears. We can massage, we can stretch the ears, we can also do corresponding points at the back of the ears, at the posterior side as well. Rub it anywhere within your concha. Lots of people like to feel for indentations as well, where they've got scars, where they've had organs removed, and feel the different textures, the anomaly. And you can pull instantly already. After a couple of minutes, it makes you feel really relaxed. So give it a go. So I left my NHS substance misuse role when the voluntary sector took over, but I continued practicing domiciliary. And I now have my small local clinic here within Bourneville, and you can see my beautiful clinic room behind me. So I was no longer working within specialist services, but I continued my CPD in auricular acupuncture, which has enabled me to treat a much wider range of conditions. So now I'm seeing a lot more of things like musculoskeletal pain, fibromyalgia, ME, migraine, joint pain, especially the hips and the knees. They're really easy to spot on the ears, as I've said, around this triangular fossa area. We've got the hip point, we've got the knee point, we've got the ankle point here, because that's where our lower extremity is, that's where our leg is. But also within the triangular fossa is our pelvis area. So anybody with gynecological reproductive issues, I want you to take a close look at this area here. I'm particularly interested in women's health alongside mental health. And I became really immersed in my reflexology CPD, such as maternity reflexology with Sally Earlham. I'm not sure if any of you have done anything with Sally. I've done Hagar Basis as well, women's health, Barbara Scott to support fertility, advanced reflexology techniques with Tony Porter. In fact, I'm going to one of his webinars this evening. Harold Samuel for pain and nerve reflexology, Lynn Boo for vertical reflexology. So as I immersed myself and really understood about reading the foot, the colour, the texture, the anomalies, I translated my knowledge to the ears and saw lots of patterns and parallels from the reflex areas on the feet onto the ears, and the markings that I saw, some interesting patterns. So hormonal imbalances and fertility issues, we can see on both of these ears that are on your screen here. Both of these women have polycystic ovary syndrome. And there's 2 places on the ear I want you to look at where you can see it. So I've mentioned that the pelvis is here within the triangular fossa. And what you can see, particularly on the image with the circle here, you'll see lots of different colors in there. You'll see bright red where it's acute, it's inflamed. So that's indicating there's inflammation in the system. You'll often see purple. Look at the color on the ear there. Can you see that purple color? So purple means stasis, stagnation. So there's dysfunction within that area. And one of the other things that I always see as well, in people with endometriosis, is you get an uneven texture within here as well. You kind of get a grittiness lying within here. I've seen it hundreds of times as well. Obviously, these 2 people, I know that they've got polycystic ovary syndrome because they've told me they've got that diagnosis. But even if you don't know somebody's diagnosis of endometriosis or adenomyosis or dysmenorrhea issues with, you know, their periods and really heavy periods, and we know within reflexology we can help with the people's cycles, can't we, and regulate their cycles. So have a look at your progressive discoloration chart. What else do you see on the ear, the picture without the needles on? So I've described some colors to you. What else can you see on this person's ear? If you could put your answers in the chat, that would be great. And where on their ear? I know you don't necessarily know the ear map, but we can figure it out. Your answers in your chat. What colours do we see? What anomalies do we see? Anybody? We've got this distinct difference between the anti-helix here, and then it goes completely pale, doesn't it? White into pink on the outside, absolutely. The white, Catherine. And then we've got the redness, haven't we? Yeah. And can you see how they're really quite stark in their colour change? And you'll see this a lot as well. And around here, our adrenals are here. Can you see the really pale white part around here? We've got a tranquility point here as well. We've actually got points here that are excellent for weight control and weight management. This person's hormones are completely off. If you have a look at the picture with the needles in, can you see the blue circle here into the intertragic notch here, where we've got the needle sticking up vertically? This is our master endocrine point. This is our pituitary gland. So have a look on people's ears when you see this, as well as up here in the triangular fossa. Have a look here. What colour is this on this person here? The picture with the needles in. What colour is it? And it is an area, not just a point. It's our master endocrine area, pituitary, which is the conductor of our other hormones, part of the HPA axis when people are dysregulated and stressed. What colour do we see?
Dark red.
Red, absolutely. That's showing inflammation. You'll see this on people with reproductive and fertility issues. Is here. You look for this redness here and here. You'll usually see this is quite acute red, and you'll often see this as stagnated, but red as well, acute red. So it means it's happening now. Those brown colours, the light brown, the dark, means chronic. It's healing. So those are some really interesting things that you can look for on the ear using your ear chart, which is there, and you've got. So 8 years ago, I took a divergence and qualified as a secondary school English teacher, and then I became a specialist social-emotional behavioural difficulties and mental health teacher with the most wonderful mentor at the University of Birmingham, Dr. Neil Hall. So this meant that within a education setting now, no longer health setting, I was working with very dysregulated young people within mainstream education system, mainly students that had neurodivergence and special education needs, and they struggled to fit into the routines and demands of mainstream education systems. My responsibility, which is an absolute passion of mine, is I was caring for the looked after children, the previously adopted from care children, and the children who are young carers themselves, often caring for siblings and parents with mental health issues themselves. So obviously I was not able to directly use auricular therapy within an education setting, or even the seeds within an education setting, because that's actually something that I am really determined to try to change. This is so widely used within health services. I train a lot of doctors, psychologists, mental health nurses, therapists, holistic therapists, complementary therapists, and it's widely used within addiction services as well. Why aren't we using this within education and helping our vulnerable young people who are really struggling to stay regulated within education services, mainstream in particular, as well as alternative provisions, as a way to help them stay really regulated. So I'm just going to admit somebody to the call. There we go. And what I was seeing, because of course I took picky looks, sneaky peeks at their ears, and what I was seeing a lot of was what you can see on those images. So what you could see in particular was around the antitrachus here, people with mental health issues, and this Romoli shows this within his book in particular as well. Can you see this puffy area, the protrusion here on the antitrachus? This is something you see with people with mental health issues, particularly anxiety and depression, as well as that bright redness that you see in people. Look for these protrusions, these puffy areas, as well as the creases for people with anxiety and depression. The nevi that I showed you, the nevi, it's like the little brown kind of large freckles. Can you see she's got one here, over here, which is near to the tranquility point. It's very close to the adrenals, and she's got one here as well. This is close to brainstem. This is close to our autonomic nervous system point. This is close to our occipital point. And what I find when I treat the occipital in particular is it clears people's minds and brain fog really quickly. This person's here is really, really clearly showing she's got this gorgeous triangle going on with the nevi, with the pale areas and with the puffy protrusions, that they are struggling with mental health difficulties. I've also put the reference here into two charts, Dr. Barr's chart and Dr. Beat's Strickmaster. They deal with and advocate for the German system. So Dr. Barr actually trained with Dr. Nourgier. Obviously, he's the French system, and so there was a slight diversion in how they were treating. So Dr. Nourgier, he in particular introduced the VAS, but Dr. Barr's chart, which is a little bit dark, I do apologise, he's showing us our HPA axes, those three circles on there. So we've got the hypothalamus, pituitary, adrenal axes that is on the ear, and those are the three places. So you've got your adrenal here in the tragus, you've got an ACTH point down there, which can help balance the HPA axis. The hypothalamus is tucked just behind the antitragus point here, and the pituitary I've spoken to you about, because the master endocrine pituitary point here, this is balances our hormones in people with reproductive issues. So alongside teaching them cognitive behavioral approaches, mindfulness approaches, breath work, I also taught them hand and ear reflexology. But just taking a look and visually inspecting their ears showed me what was going on within the limbic system. So the reference to Dr. Beat's Strickmaster there that you can see is the limbic system that is represented just under here along the antitragus. I want you to look for here. You know when people are dysregulated. This is also our headache line as well. Though I put a picture on earlier with seeds on the headache line. So because we can access the cortexes of the brain here, the frontal lobes here, right the way back to the hindbrain, we can actually access the limbic system here as well as the HBA axis on the ear. So you will often see as well these creases, and look out for where those broken blood vessels appear as well on the ear. And they're helping to reinforce what Dr. Oleson and Huang says is, it is as if the ear can speak for and express itself. The ear can talk, she says. So Dr. Oleson and Huang is known as the mother of auricular medicine, in a similar way to Eunice Ingham is known as the mother of reflexology. So as I said at the beginning, if only we are able to listen and make sense of the stories that the ears are telling us. So my 2-day on live workshop that I've mentioned to you, that teaches you 7 different skin alterations of the auricle. The auricle just means the outer ear. And I use real ear photos, different to what I've shown to you today. Today I've taken a as how we can use auricular therapy and bring that to life with the people that I've met within many different settings, not only health. So within my workshop, I scaffold using a framework, and you step by step learn each of the different anomalies, and you will see the evidence base that I introduce of Huang, of Romoli, of Oleson. So it's Western as well as Oriental perspectives. And you'll go through the framework, learning them, each of the 7 anomalies step by step, as well as the clinical pearls that I learn. And it's a really interactive thing. I ran it a couple of weekends ago, and I invite you to share your own ear pictures as well, not only of your ears, but ears of your loved ones, your family and your friends. And we visually assess them as a group as well. And I also invite you to something that I'd really very much like to embark on, which is replicating the double-blind controlled trials of Romoli and Oleson that they have conducted, looking at the accuracy of what they call auricular diagnosis. So Oleson very famously did one in the 1980s, and he looked at musculoskeletal pain. He had his patients shrouded in a sheet, so the practitioners weren't able to see what was going on with any musculoskeletal issues that the patients had. He used an electrical stimulation device, which is widely available. Anybody can use it. And he was 86% accurate in determining, remember this is the spine in particular, the accuracy of what was going on, what was wrong with these people who had a diagnosis of issues of musculoskeletal pain. So I'd like to replicate some of these double-blind controlled trials. So if you wish to take part in that with me, I'd love you to just get in touch with me via my website, or if you come onto my course, you're invited. And this is something that we can do together. I'd really love to access some funding to be able to do this, you know, to continue to raise the profile of auricular therapy and how accessible and versatile it is. We're all therapists on here, whether it's a talking therapist, psychologist, or working with the body and the system. We're all working with the brain directly, indirectly, whether that's a TCM perspective or a Western perspective through the meridians and the yin and yang, or through neuromodulation. I'd really love to be able to get some funding to do this kind of research. So just very briefly, just before we come to a close, here's a snapshot from my 2-day workshop, where here I am proudly displaying one of Huang's auricular diagnosis books. I'm very proud to have some of her books. And there's a picture of Nunu as well, Lucy, and that's Dr. Kashmir Goddard, who came onto the training course, and they've given me some amazing testimonials. Nunu says, I attended the Year Talk workshop with Anna to further solidify my knowledge on identifying certain health traits and conditions. I can't recommend it enough. It was informative, delivered to perfection, and it was mind-blowing to learn how certain skin conditions, previous history of health, shows up on the ear, which I showed you at the beginning with my medical file imprinted on my ear. So Nunu is a complementary therapist. He's a worldwide skin consultant. He's a Reiki practitioner. I know some of you on here do Reiki, and he's a crystal healer as well. I've now left my education job. And as I mentioned, I'm here within my wonderful clinic space at Woodbrook, which is George Cadbury's former home. We're really lucky enough to have not only a beautiful space here within the house, but we've got these stunning gardens as well. I was very frustrated and disillusioned with the education systems. I'm not here criticising schools, just the systems and the lack of resources and the inept ability to support our most vulnerable children with special education learning needs and neurodivergence. And I left at Easter, and a wonderful thing happened. So 1 week after I left, as I was feeling guilty about leaving, the young people that I built very close relationships with and really supported them through their trauma and attachment and issues and ADHD and meltdowns and mental health difficulties, and particularly anxiety is huge within presentations within schools. A mother made contact with me and asked me if I could support her daughter who had autism and, you won't believe, eating disorders. So I feel like I've come full circle. If you remember, I said at the beginning, when I was asked to work with young people with drug and alcohol treatment services, I actually wanted to work with eating disorders because it's just an area that really interests me. So that's something that I'm now doing alongside supporting families, in particular with ADHD. I'm currently doing an ADHD project supporting young people and families, teaching them how to apply seeds. Here's one of the seeds, auricular therapy, not only to impact neuromodulation, and we know the pathway that is implicated with ADHD and the blockages to the prefrontal cortex, and we know that the vagus nerve helps with following that norepinephrine pathway. So not only on that functional level and the neuromodulation level, but also as part of family therapy as well. I am trained in family therapy approaches. A lot of relationships become very fractious within people with neurodivergence, particularly ADHD, and some of the relationships within the family breakdown and trauma, lots of other things as well. Don't have to have mental health or neurodivergence for that to happen. And this is something I'm currently doing, working with family and working with the young people, teaching them how to put seeds on each other at specific ear acupuncture points. Only the seeds, I'm doing it needle free, using the points that I know, using the points that are evidence-based within ADHD and executive functioning. So it's got a really wide use, you know, particularly in terms of anybody with executive functioning challenges or anxiety or who are dysregulated. And I'm having wonderful results. It's made a massive difference to the family. So the universe appears to be send me people who I was wanting to help within education system in a way that I can work with them within my own clinic, and supporting not only that neurodivergence, but those family interactions, those positive relationships as well. The picture that you've got there is me doing Qigong. When I do my face-to-face training courses here, I have my FHD accredited stress and anxiety course. I'm also a NADA trainer as well. I've spoken about some of the wide use and evidence base of that. We will make use of the grounds when weather permits, go outside. The picture there is the concentric circles that Quakers used to use for mindfulness meditation. They used to walk around and do walking meditation. So the building here was in Quaker hands for 120 years. It's got the most beautiful feeling. And People, when they come to my face-to-face training, say that they feel like they're on a retreat, and it does very much feel like that. It's extremely calming. So I want to offer you a discount as a thank you from me for attending my webinar. There is wish to come on my course. It's on the 17th and 18th of July. There's a QR code there on the screen. If you want to get your phone out, have a quick go at that. I can also send you details on through email as well. As I said, it's different material to the ones that I've presented today, but it will be introducing you to this idea of this framework of 7 skin alterations on the ear to indicate health, so that enabling you to understand not only the anatomy and the map of the ear, but the visual inspection, the ear inspection, the ear assessment, the ear reading, and enable you then to treat using the seeds, treat using ear reflexology, and treat using palpation as well. So if you want to join me, I would love you to come. That is online. It's live as well. It's taught live. And just finally, just to give you another couple of the testimonials, practitioner feedback, Dr. Kashmir Goddard, she's a systemic psychotherapist. She's also an addictions counsellor. And she also works for the local authority as an education advisor. She says this is such an amazing course. It was so informative, and I feel privileged to have been able to do this. What a brilliant trainer Anna is, and she's so knowledgeable and runs the course at an excellent pace. Forgive me if you think I'm trying to big myself up. It's not my intention to be boastful, but I just wanted to give you a flavour of some of the things that the people that came on actually, that you know, they are therapists, but also psychologists, psychotherapists. Lucy's a body acupuncturist as well. I've spent a wonderful weekend on the year course learning that our ears hold our medical file records and that the ears don't lie. That's my mantra too. It's been absolutely fascinating and valuable. My confidence and knowledge has been boosted in the generous, supportive and fun learning space. It very much is fun, interactive. You form part of that learning. Created by Anna, I feel invigorated and excited to start putting what I've learned to good use. Thank you so much. I can't wait for NADA course in June. So I've got NADA running across 2 weekends in June. I've got NADA running in weekdays in July. I've got my stress and anxiety running July, August and October as well. All details are on my website if you would like to join me. So I realise that I may have just rushed that last final bit. I'm just going to go back to popping that on the screen for you in case you need a moment to get your camera out to scan the QR code. Are there any questions? Have you found this helpful? Is there anything that you, thank you, Linda. I really want you to just take a minute just to massage your ears, stretch your ears, massaging the concha here. What can you feel on your own ears? Have a look in the mirror. What can you see on your own ears? Anything that aligns, if you think of that very crude, brief, dividing the ear into 3 in a very simplistic way, and our digestive system actually goes as a U shape around this helical ridge here. It goes in this nice U shape. It's so easy to find points along here with our upper digestive system, mouth, bronchi, trachea, esophagus, and then going around to stomach, and then go around to small intestine, heart, large intestine, all the way down to anus here. Have a look in your triangular fossa and the joints. Have you got any of those broken blood vessels around the hip, the knees? Any reproductive issues, menopausal symptoms? What about in the endocrine here? Have you got anything there? Any digestive systems, any lung, breathing difficulties, anything around here? That's, you know, can indicate headaches, mental health. Have a little look, put in the chat. What do you see? What do you notice in your ear? Anything in particular? Pop it in the chat and we can have a little chat. And any other feedback? Thank you, Linda. Much appreciated. Thank you so much. I appreciate you joining me. Thank you. Anything else you want to talk about? Any questions you have for me? I've spoken quite a lot. They're quite a fast pace because when I get excited about, because, you know, I love ears, you know, they still astonish me to this day. I had somebody, when I talk about sharing on my workshop, somebody that came onto my 2-day workshop, he had these quite an upturned earlobe and 3 little dots on his ear here. Sorry, it was about here. 3 little dots in a line. It was actually on one of the helix points. We've got helix points on the outside. And he sent it to me and shared it with the group and said, what does this mean? And I said, I actually don't know. I don't always know. You know, I have to continue to learn and look things up. And I looked up and the helical part of the ear it was on, the helix 4 here. When I looked it up, it was actually to do with deafness and hearing. And I thought, this is going to be a bit of a tenuous link. And I said, it's to do with hearing and often is implicated in deafness. And he said, I'm actually 30% deaf in that ear. So it's amazing. It astonishes me all the time. You know, I don't necessarily know what's going on with people's health, but the ears will tell you. And you always use the ear as final guide as well. The ears will tell you what's happening in the system. Any questions? You can unmute yourself, have a chat.
Thanks, Anna.
You want to ask me anything? You want to talk about anything that's resonating?
I don't have any questions. It was
Thank you.
It was very interesting. I wish I'd had a photograph of my ear to have a look at, which I will go away and do. I've just been looking on your course there. So if the dates work for me, then I am interested in doing more like auricular acupuncture because I do dry needling already. And one of my friends who does TCM acupuncture, he's done the battlefields auricular acupuncture. So I've already been looking at that. So yeah, I'm really interested in it. So thank you very much. I do have ear seeds as well, so I sometimes use those on myself. So it was just interesting learning more about what's going on, and maybe because I'm in perimenopause, so maybe I'll look at some of those acupuncture points or acupressure points to do with that as well.
Definitely, the master endocrine point, your pituitary point here. It's an area rather than a point. Look there. And also, you know, within the reproductive system, there are lots of other points as well to balance, aren't they? But you're welcome. But yeah, I am running face-to-face courses here at Woodbrook in South Birmingham. And as I've mentioned, NADA is very wide-ranging as well. It's not just addiction. And what will happen is, you know, when you learn face-to-face, I always prefer to teach face-to-face, but obviously online we can reach worldwide audience. We'll look and assess people's ears as well as we're doing it, because I love the weird and the wonderful, and I'm always taking photos of people's ears. I've got an ear library, I've got an ear gallery, which I've curated over 20 years, and I always come across something new. So I kind of incorporate a little bit of the ear assessment into what we presented with on face-to-face course as well. So you're more than welcome to join me, or just drop me an email, Catherine. Thank you so much. I appreciate that feedback. Thank you.
See you later.
Take care.
Bye.
Thank you. Bye. Anything else from anybody?
Thank you very much. It was amazing. Sorry I joined late.
Victoria.
Yes.
Not at all. Thank you so much. Thank you, Victoria. What therapies do you practice?
Yes, complementary health therapies, massages, Reiki. I'm a Reiki master healer, master teacher. Yeah. So, but I'm new in the UK. I'm a Nigerian. I've lived in Nigeria all my life. So I'm open to different therapies. So when I saw this, it sounded amazing, and I'm wowed.
Oh, thank you. That's so kind, Victoria. Well, you know, you can see how enthusiastic I am. But yeah, you're very welcome to join me either on the online course or the face-to-face courses as well. And I can tell you something, Victoria, about Reiki practitioners. They are amazing at the Korean flying needle technique. Oh my gosh, they're fantastic. If you have a look on my Instagram, you'll see where people do because we spin the needles in to wrap the nerve fibers around the needle. We don't just press them in. Reiki practitioners, because they practice energetically. And I like to teach you acupuncture in an energetic way. Thank you, Stephanie. Amazing at the flying needle technique. I love teaching Reiki practitioners. They bring so much to the course. Thank you. Thanks, Victoria. Thank you.
Thank you.
Bless you.
Bye-bye.
Thank you.
Yes.
Bye.
Yes.
Anyone else? Ah, Elaine, hi. You still there? You can unmute yourself. Did you want to ask me anything, Elaine?
Hi, Anna.
Hello, you okay, Elaine?
Yes, I'm fine, thank you. How are you?
Oh, I'm really well, thank you. Thank you so much for joining me. I really appreciate it. I hope it was helpful to you.
Extremely helpful, thank you. I've just
Oh,
started out on my Reiki training journey.
oh, Reiki, did you say?
Yes, yeah.
Wonderful. I don't
Elizabeth.
do Reiki, but I love working with Reiki practitioners.
My Reiki master's amazing. He's taught me so much.
Wonderful.
Yeah,
Do you do
I'm a massage therapist anyway, and I do aromatherapy. So yeah, I just, when I saw this webinar, I thought I've got to do that.
Oh, it is fascinating. I mean, I know I talk at a pace. It's because I'm so excited. Still, you know, it still astonishes me on a daily basis. You look at somebody's ears and it just seems to fit. You know, you just assess what you see because, you know, the ears don't lie. They'll tell you what's happening. And really precisely as well. So I treated somebody with sciatica yesterday, and I was talking about L5S1 on the ear, which is here, just off the edge of the antihelix. And she had this broken crystal exactly at that point. And you know what was so interesting? She massively bled when I removed the needles. Setting is a really good thing. You know, the Chinese bloodlet, and it releases inflammation. But I also think that it released emotional, because she had quite a lot of emotional stuff going on. But obviously, sciatica, inflammation in the system, so it's releasing the inflammation, the heat, and emotionally as well. I don't think I've ever had anybody bleed as much as she bled. And she got off my couch, and she felt so much better. She was hobbling when she walked in. So, you know, it's fantastic on so many different levels. And it goes so well with the treatment modalities, so it will go beautifully with your Reiki. So I have a lot of Reiki practitioners that I train. So, you know, you can put the needles into the ears and then you can do your Reiki. And in terms of the massage as well, what I tend to find is people will massage the back of the body first, so say back, neck, shoulders, turn them over, and then put the needles in, because you can have the needles in for a minimum of 30 minutes and then massage the front as well. And do a combination, because I imagine you'll be doing a bit of massage, you'll be doing a bit of Reiki, won't you? You'll be using the oils as well, won't you, with your reflexology. So it just, the beauty of it is it just aligns to what you're already doing. It just fits in beautifully.
It's really interesting subject.
It is interesting, yeah. And I'd really love to do a piece of research, as I mentioned as well. And, you know, that replicates those double-blind controlled trials of Romoli and Oleson. So watch this space. You know, I'm working on trying to get some funding for that. But you'd be very welcome to join me, either face-to-face courses. Where are you based, Elaine?
I'm in Telford, Shropshire.
Oh, you're up the road.
Yeah.
Wonderful. Oh, that's fantastic. Yeah. So, you know, well, you're very welcome to join me here. Woodbrook is an amazing place. It's mentioned it's George Cadbury's former home, and it's been a very loved place by the Quakers, and 120 years of Quaker prayer. It feels very calming and relaxing. We've got beautiful grounds as well. And
can imagine,
it's a very kind of healing place, a very protective sanctuary. It is a lovely, lovely place to visit, especially when the sun shines and we can enjoy the outside space as well as the clinic too. Or you're welcome to join me on the online workshop as well, whatever you'd like.